Well, like everybody, I think I just basically ignored a lot of the signals that my body was giving me over, I think, a number of years. Very general kind of symptom was fatigue, and who isn't tired? I sat down with my hematologist. He called me in as the last patient of the day. and then I was given this diagnosis that I had multiple myeloma, which is basically cancer of the plasma, the blood cells in the bone marrow. Essentially what happens is that first I used my own stem cells. And stem cells, of course, are in a sense the prototype of all the blood cells in our body. They can become red, white, platelets, and they're produced in the bone marrow. So essentially, because my malignancy is in my bone marrow, first I had to beat back the beast through using a combination of steroids and chemotherapy. So I had to be in enough remission that then the stem cell would basically clean out my bone marrow and then be reinfused with my stem cells, so non-malignant stem cells, and then hopefully have a fresh crop. After 4 months of treatment, I was sufficiently in remission to be able to be harvested, number one. So it took about a week and a half or 2 weeks. The protocol was I was injected with a drug called Neupogen, which actually overstimulates the production of stem cells so that they're released into your bloodstream. And then we just harvest those babies. I was hooked up in the stem cell suite to kind of like, it's like a dialysis machine, so the blood comes out, and then through a sort of centrifugal action, the stem cells are separated out from your blood, and then your blood goes back in. So I sat down, I watched a couple of flicks, played some Scrabble with some friends, and this really, it's I mean, to me, it was really, it's like magic. The first day, they hit me really hard with chemo. Again, taking you to the brink. And then day 2, which is actually, in a sense, day 0. It's the beginning of the rebirth. My stem cells were infused back. Well, I should quickly touch on the fact that, it takes about 10 to 12 days for your stem cells to engraft, to basically find their way into your bone marrow and start reproducing. And that's the desired result. But until that happens, your system starts shutting down. Basically, I watched my blood cell count drop dramatically every single day to the point where my white blood cell count was 0. And then, very soon after that, my stem cells started reproducing. And then you watch. And you don't need to, I didn't need to read any blood charts because I felt the difference. It's really encouraging to see that they're trying to sort of disseminate this information, get this out of here, demystify it. Because I think whether we're in India or whether you're in Canada, stem cell therapy is highly misunderstood. Even to a recipient, still sounds really out there. I mean, what is a stem cell? Like, how do you feel? Like, even blood, you understand. Like, how do you describe stem cells and what it does? And it's such a vital part of our organism. We can't speak enough about it. We need to keep, I think, banging at the awareness aspect and demystify it. That's really, really important. The fact is, I think now it's about getting the information out there, you know, and sharing, and perhaps putting a face to the statistics and the more complicated medical terminology, and just kind of standing up and saying, I'm here today because of my stem cell transplant.